the International HHT Guidelines that we published in 2020 were the second International HHT Guidelines. And it was really an amazing process. I made pink slides to try and keep us all going for this last this last half hour. I hope it's not too pink. It was an amazing process where we brought together 50 plus experts and patients from 15 countries. And the experts were, all the specialties relevant to HHT, but also guidelines, methodologists, and patients with HHT. And what we did is we followed a very systematic, structured process. We wanted this to be top-notch and recognized as a top-notch guidelines document, so that it was implemented, so that it reset the standard of care in HHT internationally. We had a pre-conference process that lasted over the better part of a year, where the international community first, and then the expert panel generated. The international community decided on 6 priority topic areas for the guidelines. And then the expert panel generated clinically relevant questions in those areas. And then we conducted a full systematic literature search on all of those questions. And then we reviewed all of the literature, and any of the studies that met our criteria were included into what we call evidence tables, and they were used as the basis for the recommendation development. And this all culminated in a 2-day conference in Toronto that we held at the Li Ka-shing Institute. And we had the 55 people from 15 countries come. This was in November 2019. So thankfully we got it in just under the wire, while it was still a normal thing to do, to get together with people in person. And it was a really amazing process, where we basically had everyone all together for 2 days. We reviewed the 6 topic areas and the recommendations from the topic leaders, and discussed those and voted on them and reworded them and discussed them again. And eventually what we came out with were, we came out with a series of recommendations where we had more than 80% consensus that we approved. And this is the group that came together. As I said, this is a funny photo to show. We wouldn't be able to show this right now. We wouldn't be able to do this right now, but it was a very special. So I'm very grateful that we were able to do so in November 2019. And this, the guidelines were supported by Cure HHT, and also a grant from a family from the Cure HHT. Sorry, I'm just having a mental block. Excuse me for 1 second. I'll show you when we get to the website. So this was very generously supported by a patient family and by Cure HHT, and that support was used to bring these people together. So here, these are the guidelines. This is how many guidelines we have. So this is why you're going to thank me that I'm not going to go through them all. We have 56 current HHT guidelines. And the ones that you can see that say 2020, those are the ones that we generated in the 2020 process. So these were our 6 topic areas that we considered priority for the 2020 guidelines: nosebleeds, GI, anemia, liver, pediatric, and pregnancy. And the reason we did not reassess, for example, lung AVM guidelines, is because we had a number of guidelines from the 2009 publication that were still current and up to date, and we felt were not a priority to reassess. So they are still part of our HHT guidelines, still part of our current HHT guidelines, and they were reiterated in the 2020 guidelines document. So just to give you an idea, okay, of what the total set of HHT guidelines are. So once we got through the guidelines process, the conference and meeting where we generated all these recommendation statements after our year-long evidence process, we then set out to disseminate the HHT guidelines, because the guidelines are no good if nobody reads them, right? So we want to disseminate them widely so that we can set the standard of care for HHT. And so the very first thing we did was publish the guidelines in a high-profile, widely read journal, the Annals of Internal Medicine, which is the #6 medical journal in the world. So we were very proud about that, and felt that that was a very impactful thing to do. And that includes, as I said, all 56 of the recommendation statements, even the ones that are still active from the first guidelines. And then since then, we've been publishing articles by specialty, highlighting key aspects for doctors. We've been giving presentations by specialty. I gave 2 last week to a genetics group and a hematology group, highlighting important aspects of the guidelines for those doctors. Cure HHT is running a webinar series for clinicians and patients that's starting next week, in fact, so you can check that out about the guidelines. And we felt that it was super important to make the guidelines easy access, and we did so with the HHT Guidelines website, hhtguidelines.org. Not only to make the guidelines easy to access, but some tools around them. And that's what I'm going to show you next. Okay, so I'm just going to stop share here and go there. And please tell me if this doesn't work, but I think it should. Okay. So if our moderators can tell me if you can see the guidelines website, that would be great.
Yep.
Okay, great. And I will be switching to some of the checklists. So if I say I'm going to a checklist and nothing shows up, if you could tell me, that would be great, because I know sometimes you have to stop and start sharing again. So this is the hhtguidelines.org site. As I said, this is an open website, no password required. We wanted to make sure that people could easily get the information about the International HHT Guidelines. So this is sort of the front page kind of describing it. And then also here on the first drop down, you can go by topic and go and look at, for example, the guidelines about pediatric care. And when you go there, see if this is going to work. Okay. There we go. You get a little summary section about pediatric care, each guideline, what the statement is, the quality of the evidence, the strength of the recommendation, the percent agreements, et cetera, the clinical considerations, like how to apply that recommendation statement. So each topic has a list of recommendation statements that are detailed in this way, and that you can list them or look at the details. And then there are some resources in terms of background references, et cetera, that are detailed as well. And then under the publications tab, we have the guidelines documents that are open access. So nobody needs to have to pay for this. This is like readily available here and on the Annals of Internal Medicine site. You can download the executive summary, the online supplement, et cetera, for the second guidelines and the first guidelines as well. And then I think even most importantly, over here on the resources section are what we call the HHT Care Checklists. So we put these together to try and help people bring the guidelines to their primary care physicians and other physicians, and also to know themselves whether they're getting the HHT care that they should according to current HHT clinical care standards. So this is the care checklist page where we made an overall HHT care checklist, and then there's one for each that basically is in parallel with each topic of the guidelines. So I'm going to go and show you, for example, the one from pulmonary AVM. So pulmonary AVMs, I said we didn't reassess the pulmonary AVM guidelines, but they're still part of the International HHT Guidelines because they're still very much current and active. And so we have a checklist for pulmonary AVM care. And as I mentioned earlier, that's kind of one of the very first steps when we see someone with HHT is let's make sure we screen them for lung AVMs and treat them preventatively, because we have this low risk and highly effective treatment, embolization, to prevent serious complications. So this is the pulmonary AVM checklist. Can one of the moderators tell me if you can see this?
Yes.
Perfect, thank you. So each checklist is designed the same way. The front page has a bit of a description about the guidelines, a bit of a description about pulmonary AVMs, and then has a series of check boxes, and I'll come back to in one sec. And then on the second page is the actual, and this is kind of like the back page, let's say, if it were printed out, it's the actual clinical guidelines recommendation. So this is like the reference for the doctor. And then this is the part that the person with HHT can use and fill out and take to their doctor. So, so here it is, I have HHT, or I might have HHT. And so if I think that's the case, then have I asked my doctor to screen me for lung AVMs, typically with a contrast echo? And then, let's say you show this to, you say, okay, look, I haven't done that. You take this to your doctor, and then you show them on on the back page that it says clinicians should screen all patients with possible or confirmed HHT for lung AVMs, and that they should use transthoracic contrast echo, which is the other name for bubble echo, as the initial screening test for adults. So this is the way we've structured all the checklists, and we've tried to make it as clear as possible for people to be able to make sure that they're getting the standard of care care for their HHT. Okay, and so you don't just have, this isn't just for you to take to an HHT center, you can take this to your family doctor. So that's the pulmonary AVM one. And then I just want to take one more minute to show you another one. I thought it might be good for us to look at the nosebleed one. So here's the nosebleed one, because we have actually, if you might have noticed when I showed the slide of the 56 recommendations that there are some from the first guidelines for nosebleeds care and some from the current guidelines. And nosebleed or epistaxis care was prioritized as a priority topic for these guidelines because we had new recommendations, new evidence, and so we wanted to incorporate some new recommendations in the clinical care of HHT patients. So, so again, this is the same thing. What's the guidelines? What's the sort of clinical relevance of nosebleeds and HHT? And then here's the checklist. So I have nosebleeds that bother me. I rate and I rate my nosebleed severity to help guide my nosebleed care. So this is one of the things that the HHT community is really strongly recommending, is that people use the Epistaxis severity score, which you can find at this link, to rate the severity of your nosebleeds, and that you take that to your doctor, and that you have that information. I have ESS score 5, which is moderate nosebleeds, for example. And the idea is that if we know what the severity of people's nosebleeds are, then we know that it reinforces that you need treatment for your nosebleeds, and that you deserve better than a nosebleed score of 5, for example, and that this is something that we can change. And then next step, talk to my doctor about moisturizing or topical therapies for my nose. You heard something about some of those from Dr. Yaver earlier, that's a really important first step, is lubricating the nose. But then after that, when nosebleeds don't get better with moisturizing, the clinical guidelines, the 2020 guidelines recommend treatment with oral tranexamic acid tablets, okay, with oral tranexamic acid, and to see an HHT experienced ENT doctor to consider treatments like laser, etc. So, we put these kind of on par, because those are both sort of the next phase. If you're not doing well enough after just basic well care for the nose, then these are the things to be considered. And there's quite a bit of evidence supporting both of these that are detailed in the HHT guidelines. And that if the nosebleeds are affecting my quality of life, or they're life-threatening despite those approaches, despite tranexamic acid or ablative therapies, then the next step is to consider systemic anti-angiogenic therapy like bevacizumab, as we discussed, and to talk to an ENT doctor about some of the more advanced surgeries like septodermoplasty, or about the Young's procedure, which in some patients with very severe nosebleeds affecting their quality of life, it can sometimes really be a lifesaver. So, I want to make sure that everyone has access to these lists, and that you can take this and sort of make it your own. Sort of, am I getting what I need for my HHT care? And on the back of this, as I mentioned for the other one, it has the list of all of the recommendation statements. And of course, you can always refer back to the website, or your doctor back to the website, to download the full documents as well. So I'm going to stop there and leave a few minutes for questions. I appreciate it. Oh, actually, one last thing I wanted to say. When I was having a mental block before, terribly, it was about who the sponsoring family was for the HHT guidelines, and it was the Christopher McMahon Memorial Fund. So I wanted to acknowledge them, and my apologies for my mental block earlier. Thank you.
Okay. Thank you so much, Dr. Faughnan, for that insightful talk on these international guidelines.
My pleasure.
There are no questions so far.
Well, that's a really good sign, maybe.
So maybe we'll wait a couple of minutes to see.
Yeah, sure. Absolutely. And I'll see if I had any other notes too, because I knew there were a few questions that came up over the course of the day that I thought I should loop back about, but I think we got back to them in the center care questions. So I do really think, in answer to that question earlier about the person who couldn't get care in Brazil, that bringing these checklists and and bringing the guidelines to your doctor in Brazil is a really important place to start, as well as reaching out to Cure HHT. And I say that to anybody who's in a country that doesn't have access to care. In Canada, I would say contact one of the HHT centers. The contacts for the HHT centers and clinics in Canada are on HHT Canada's website. And I'm sure that if you're from an area where you don't have an HHT center or clinic, you could call any of those clinics and we would help connect you up with care.
Okay, great. So I believe there are no questions, so we will wrap up.
Okay, thank you.
Thank you, Dr. Faughnan, for
Pleasure.
Presentation and the expert presentations on both conference days.
Thank you.
So this final talk will wrap us up for the day. So before we end off, a warm thank you to all the scientists and doctors who spoke at this virtual conference. Despite the pandemic, we are all still trying our best to spread awareness of HHT, and absolutely none of this would have been possible without you. And the board would also like to thank our wonderful, wonderful volunteers who have been hard at work behind the scenes, setting up the conference and moderating the talks, and especially for you, the viewers, for showing such interest in HHT and supporting this conference as well. So with that, Mr. Anthony Tanavici will be presenting an award to one of our speakers, followed by some closing remarks, and that should end us off for the day.
Thank you very much, Xicheng. And thank you, Dr. Faughnan and Fel and Apperly for some excellent talks and discussions. At the moment, I want to present, let me get gathered here, sorry. So before we end this conference, I would like to present our Clinician Scholarship Award. So we're offering this scholarship to support a clinician to visit another HHT center to develop HHT expertise. Dr. Apperly traveled to the Toronto HHT Center at St. Michael's Hospital last year and received training in the treatment of HHT. He brought these experiences back with him to St. Paul's Hospital to incorporate them into the care of HHT patients in Vancouver. We are honored by his commitment to improve his skills and ability in the treatment of HHT. It is our pleasure to present him with this scholarship.
Thank you so very much, and such a generous mention by HHT Canada. So it's very much appreciated. It's an interesting journey as you go through doing medicine, and many times you're often shaped by those around you. And so my experience in Vancouver training, working with Pierce Wilcox, who saw HHT patients for many years, followed by I did my interventional fellowship in Calgary in Dr. Fell's division, working with the University of Calgary colleagues, and thereafter spending some time, albeit some short time, but some time with Dr. Faughnan in Toronto. It's really you are a product of those around you, and it's truly wonderful to be part of this community from the perspective of having HHT colleagues and also working with HHT patients and families. So thank you so much.
Our pleasure. Thank you so much. So I'm going to end with a closing address. That concludes the HHT Canada 2021 Virtual Patient Conference. We sincerely appreciate all of our speakers taking the time out of their weekend to provide informative and educational talks. And we're very appreciative for all of our attendees, and we hope that it has been an educational and inspirational weekend. I'll try to be brief, so please bear with me. But I would like to acknowledge our board and volunteers at the moment. Just give me one moment. I'd like to share my screen. So last but certainly not least, we greatly appreciate all of the work the board, and this is actually an image of us at the in-person conference that we hosted in 2018. I'd like to acknowledge all the hard work the board has committed, and especially our hardworking volunteers who we actually just signed on to the team a year ago or so. And our volunteers have contributed a great number of hours and effort into producing this event this weekend, and we greatly appreciate their help. And just some final remarks. We certainly hope to host an in-person conference in the near future and wish that everyone remains safe. Like and follow us on Facebook to stay up to date if you haven't already. Please continue to be involved in this community. We are a small community, but strong. Our research community strives to learn and understand more about this disease to improve diagnostics and treatments. Our medical community strives every day to provide the highest standard of care for their patients. And above all, our patient community continues to persevere, overcoming the many challenges that HHT presents, which inspires us all to create a brighter future. HHT Canada is striving to play its role in the HHT community, to spread awareness, to educate and raise funds for HHT healthcare and research across Canada. We certainly hope to plan more patient conferences in the future, and hopefully these will be in person. We had planned to host a spin-a-thon fundraiser before, but this still remains on hold until it is safe to carry out in-person events. We plan on providing more clinician scholarships so that other clinicians, nurses, or scientists could receive specific knowledge on HHT. In the future, we hope to raise funds to contribute to the North American HHT Registry. Contributing to this registry is a great benefit to all HHT patients, as it allows clinicians and scientists access to large data sets to improve drug development and to further study the disease. We sincerely hope that we inspire others to take action and get involved, and this can be done by simply liking and following us on Facebook, sharing our page and posts with friends and family. Donations in any amount are greatly appreciated and allow us to continue to achieve our goals for the community. Sharing our brochure, which is available on our website, to your doctors, friends, and family can help spread awareness, and attending events like the ones this weekend allow us to spread awareness to an even larger audience. It is our mission to support this patient community. And again, we may be small, but we are strong. Thank you for attending our patient conference. We sincerely hope it was an educational experience. Please check your emails in the next coming weeks for a conference survey. Thank you and enjoy the rest of your Sunday.
Thank you, Anthony, and all the volunteers. It was a wonderful conference. You guys did an amazing job. It was really outstanding.
Much appreciated. We certainly appreciate all the speakers this weekend that have contributed great presentations.
It felt like a very lively conference, didn't it? Even though we were all apart and on Zoom, it seemed like it was really good. There was a really good sort of vibe to the whole conference, you know, and I think you guys made that happen. The HHT Canada team and the volunteers, you made it really nice and personal. So thank you for that.
Thank you. We sincerely appreciate it.